Hi, I'm Laura Von Sagern, Frazer's Specialty Mobile Healthcare Manager. It's my pleasure to be here today with you at Singing River Health System Stroke Symposium. When we come to these meetings, we bring VR goggles so that you can step inside our mobile stroke units. We have created that experience for you online so that you can still visit all of those mobile stroke units and climb inside and look around. A mobile stroke unit is a regular ambulance with a CT scanner inside. The CT scanner allows the team to take a scan of the patient wherever they're found, in their driveway or whatever the scene may be. This allows them to triage and treat on the way back to the proper hospital. The most important thing is that they determine which hospital the patient should go to, and they can give TPA if required on the way back. Mobile stroke units are being used in the United States across the country. The first mobile stroke unit, Houston Mobile Stroke, was started almost 6 years ago by Dr. Grada's team. They have some great information in Houston about the time saved. It's amazing. There are over 20 programs throughout the country, and they are coast to coast. Several programs have several units. For example, New York Presbyterian has 3 in the New York area. They're running 1 in Manhattan and 2 in the boroughs. A mobile stroke unit is embedded into the community's 911 system. This allows the unit to be deployed as a specialty unit within the whole system. It's kind of like if you have a ladder truck at a fire. You wouldn't always deploy your ladder truck because it's not always needed. The same is true with a mobile stroke unit. Depending on what's heard on the 911 call or what a paramedic sees on the scene determines whether this specialty unit gets deployed. When it does, whichever team, that unit and another unit gets deployed at the same time. Whichever team shows up to the patient's environment first is the team that assesses that patient. That patient then is determined whether they're going to get a scan by the mobile stroke team. Sometimes the first team that gets there is not the mobile stroke unit, and they find out that the arm weakness that was reported might be an 8-year-old who fell out of a tree. True story from Houston. And so they're disregarded. And that simply means that they're put right back into service from wherever they are. And this allows the mobile stroke unit to be used for those cases that actually need it. The crews on the mobile stroke unit can vary. Typically, there is a nurse, it can be a critical care nurse or a physician's assistant, but usually it's a critical care neuro nurse. There's also the CT tech who is running the scanner. The CT tech, in some cases, is also certified as an EMT basic. This helps the crew to ensure that they have the best crew in the field and can have the smallest team if an EMT is required on the unit. Also, you would have your paramedic. In some cases, you have to have 2 paramedics. So you can have a crew from 3 to 5 on the unit. Also, you have a neurologist. This neurologist can be on board, or they can be on board via telemedicine. This is the most common practice today. The first couple of years that mobile strokes were running, neurologists were on board. They wanted to ensure that they would get the same read as someone who was reading the scan and making the call from a telemedicine perspective. So they actually did a study to check on that. They found out that the agreement rate was 85%. That led to an idea. Hey, if you have 2 neurologists standing by the bed of a mobile stroke or a regular stroke patient, do you come up with the same agreement rate? That agreement rate was 86%. So they determined telemedicine was just as good as having a neurologist on board the unit. Telemedicine has been extremely successful, and one of the most often asked questions is, what telemedicine system does a mobile stroke unit use? The answer is any one the hospital system would like. There are several different telemedicine systems that are used by hospitals throughout the country. To get started with a mobile stroke unit at your hospital, just give me a call. The most important thing is to talk through all of the groups that need to be involved in this decision. One of the most important components of starting up a mobile stroke program is the collaboration between fire and EMS and the hospital. If your hospital already has EMS, that's extremely helpful. But most hospitals don't. And so the rest of them have a partnership with whoever the local provider is. It is a great idea to get these folks involved with your discussions early because they have certain requirements for an ambulance that doctors and nurses and radiologists don't normally have to think about. Like, which radio do you want? Do you want intercoms? Do you use a defibrillator that's a life pack, or is it a different one, like a Zoll X series? Things like this. So you want to make sure to have all the right people in the room. I'll talk through that with you. We'll set up a meeting and we'll get together in person and provide a presentation and a Q&A session for the entire team. I look forward to hearing from you and helping you from concept through go live and beyond. Thank you for your time. In your post-show packet, you'll find our brochure. It tells you a whole bunch of information about the mobile stroke units and shows you many of our great clients as well. I look forward to hearing from you at lvonsegern@frazerbuilt.com. I can also help you with specialty critical care units or even mobile clinics. Be sure to check out frazerbuilt.com for all of your specialty mobile healthcare needs. Thanks again. Have a great conference.